Welcome to IVC. We look forward to helping you live as healthy and active a lifestyle as possible. Our team is committed to providing you with state-of-the-art personalized care. IVC is accredited by both the American College of Radiology and the International Accreditation Committee, and all of our physicians are fellowship trained and board certified. Our physicians are fellowship trained in interventional radiology. Interventional radiologists are on the front lines of clinical advances and use the latest image-guided technologies in the treatment of many medical conditions that once required open surgery. Their expertise includes management of arterial and venous disease, including varicose veins, blood clots, and other vascular disorders. You will also work closely with our experienced nurse practitioners, nurses, physician assistants, specialized sonographers, medical assistants, and office staff. IVC is committed to helping you through each step of your care, and we want you to be as informed as possible about your condition. We hope this video will help you better understand varicose veins, your treatment solutions, and the associated benefits and risks. What are varicose veins? Veins are responsible for returning blood from the extremities back to the heart. There are two basic types of veins: the deep veins that run next to the muscles and carry approximately 90% of all blood from the extremities to the heart, and the superficial veins that return the remaining blood from the arms and legs. Perforating veins connect the deep and superficial veins. Healthy veins carry blood in one direction, back to the heart. One-way valves prevent blood from pooling and flowing backward. If the valves don't close properly, blood can pool in the legs, causing leg veins to become enlarged or varicose. Varicose veins can cause leg pain, heaviness, vein bulging, skin discoloration, blood clots, and even skin ulceration, often resulting in significant disability. Women may also suffer from chronic pelvic discomfort due to varicose veins in the pelvis. If you suffer from chronic pelvic pain, please let us know, as this may be due to a related but treatable condition called pelvic venous congestion. What causes varicose veins? Risk factors contributing to the development of varicose veins include genetics, pregnancy, female gender, trauma, blood clots, obesity, and occupations that require prolonged standing. Many patients with a history of blood clots in the deep or superficial veins suffer from chronically painful, swollen legs, as well as skin discoloration and skin ulceration. This may be a result of associated scarring inside the affected veins, blocking the normal return of blood flow to the heart. General treatment overview. Let's talk about how we treat the varicose veins found in your legs. Once we learn about your medical history and perform a physical examination, we perform a detailed ultrasound evaluation to better understand your unique anatomy and the extent of your varicose veins. Occasionally, we may need to perform other imaging tests, such as CT, MRI, and venography if we suspect problems with pelvic or deeper central veins. Using this information, we develop your treatment plan. Varicose vein treatment is broken up into steps. Often, the externally visible veins are the last to be treated. Primary sources of reflux typically need to be addressed before treating visible surface veins. The complete course of treatment is usually spread over a period of 1 to 6 months. Patients should expect their legs to possibly look and even feel worse during treatment. Complete recovery can often take several months, depending on your unique condition. Typically, we perform a combination of treatments to fully treat varicose veins. Of course, our physicians and providers will work with you to create your personalized treatment plan and schedule any necessary follow-up ultrasound appointments. Let's look at an overview of the most common varicose vein treatments. Endovenous ablation. When a long, straight segment of a superficial vein needs to be treated, we perform an in-office procedure called endovenous ablation. A small diameter tube, or catheter, is inserted into the target vein, through which treatment is performed. The ablation procedure takes approximately 1 hour from start to finish. After it's finished, a steri strip is placed over the entry site and a prescription-strength compression stocking is placed on your leg, which you will need to wear for a few days. You are then released to go home. We'll want you to stay active and resume most daily activity immediately. Ultrasound-guided sclerotherapy. Ultrasound-guided foam sclerotherapy is an in-office procedure used to close symptomatic varicose veins. Foam sclerotherapy is often performed on veins that are not externally visible and cannot be treated with an endovenous ablation catheter. Polydocanol and sodium tetradecyl are the most common sclerosing agents we use. These agents are relatively safe and have been approved for use in liquid form by the FDA. However, because we foam these agents in order to increase their effectiveness, their use as foamed agents is considered off-label by the FDA. However, it is considered a standard of care in the United States and is offered by most physicians who specialize in vein treatment. Using ultrasound, a small needle is inserted into the problematic vein, and a small amount of the foamed sclerosant medication is injected. Following sclerotherapy, you will wear a prescription-strength compression stocking for a short time. Again, we'll want you to stay active and resume most daily activity immediately after treatment. Ambulatory phlebectomy. Ambulatory phlebectomy is used to remove segments of superficial bulging veins. By physical exam or by using a special light or ultrasound, we identify the veins to be removed. Local anesthetic is injected to numb the surrounding area. Once the region is numbed, the diseased veins are removed through several small 2 to 3 millimeter incisions. Upon completion of the procedure, steri strips are applied to the incisions. A medical-grade compression stocking is then placed over the leg, which you will be instructed to wear for several days. It is important to stay active by walking and performing most daily activities after your procedure. You should keep the incisions clean and dry for the first several days to prevent infection and minimize scarring. Cosmetic spider vein treatment. Spider veins are tiny veins that are easily visible in the skin. They are typically treated using a process called visual sclerotherapy. During this procedure, a sclerosing agent is injected into the veins using a small needle. The sclerosing agent closes the spider vein by irritating the vein wall lining. Dilute polydocanol and sodium tetradecyl are the most common sclerosing agents we use to treat spider veins. These agents are relatively safe and have been approved for use in liquid form by the FDA. After the procedure, compression stockings are applied to help keep the vein compressed, preventing blood from re-entering the vein. Localized compression is required continuously for the first 48 hours. Properly fitted medical-grade graduated compression hose are required during the day for 2 weeks following each treatment session. It is also recommended that you avoid sitting or standing for long periods of time and that you walk frequently each day. It is normal for spider veins to initially look worse after treatment before they look better, and it may take several months before some treated veins begin to lighten and improve cosmetically. Complete spider vein treatment usually requires 2 to 5 sessions, but each patient typically has different treatment needs. Even with treatment, spider veins may persist or even reappear. It is also very likely that you'll develop new spider veins in the future. Treatment summary. The varicose vein treatments described briefly in this video attempt to close or eliminate diseased culprit veins. Following treatment, blood diverts through the remaining healthy veins, improving the overall circulation in your legs. Your treatment plan may be adjusted from what was originally prescribed, depending on what we see in follow-up evaluations. Varicose vein treatment is often an ongoing process with need for long-term follow-up. We'll work closely with you to help you manage your varicose veins and give you the best outcome possible. Associated risks. As with any medical procedure, and in spite of our attempts to keep you safe, there are known potential associated risks with endovenous ablation, sclerotherapy, phlebectomy, and other procedures we perform. Although uncommon, these risks include infection, bleeding, deep and superficial vein blood clot formation, skin numbness, blistering, skin discoloration, and tissue necrosis. Infection risk is minimized by our use of sterile techniques. You will be instructed to keep any incision sites clean and dry for several days after your procedure to prevent infection and scarring. Antibiotics may be prescribed in select cases to further reduce infection risk. Please let us know if you have undergone heart valve or joint replacement surgery, or if you have any other conditions that may require pre-treatment antibiotics. Bleeding is usually minimal and can typically be controlled by elevating your leg and applying local pressure. If you are taking a blood thinner for another condition, we will typically have you stay on it during treatment. Please let us know if you are taking any blood thinners, including aspirin. The risk of developing deep vein blood clots, or DVT, is less than 1% for most patients. DVT risk is higher if you have a history of previous DVT, are taking oral contraceptives, or undergoing hormone replacement therapy, or if you have a known clotting disorder. Please let us know if any of these situations apply to you. Persistent numbness, or paresthesia, occurs in about 5% of patients treated with endovenous ablation and at a lower rate with ambulatory phlebectomy. In most cases, sensation returns to normal in the affected area within 6 months. In a small number of cases, paresthesia can be permanent. Persistent numbness rarely interferes with normal activity. Skin discoloration with lumpiness can also occur due to superficial blood clots, or SVT. As the treated vein scars and inflammation decrease, lumpiness and skin discoloration will generally resolve within 9 to 12 months. In rare cases, they can persist for longer periods of time. Skin ulceration and tissue necrosis can also occur with sclerotherapy. Ulceration, or tissue necrosis, may occur if the sclerosing agent interacts with tissue outside of the target vein. Stroke is a rare potential complication of foamed sclerotherapy. Although a permanent neurological deficit would be extremely unusual, patients may infrequently describe transient headaches and visual changes that typically resolve within a few minutes. Please let us know if you have a history of migraines, stroke, or cardiac defects, such as a patent foramen ovale, or PFO, as these conditions may be associated with increased risk of stroke. And finally, in spite of undergoing a technically successful procedure, your symptoms may persist, reoccur, or even worsen. For most patients, however, the benefits of treatment outweigh the potential risks. Please let us know if you have any other questions regarding the potential risks of vein treatment. Conclusion: varicose veins can impair your lifestyle and result in significant disability. With the help of our team of specialists and state-of-the-art diagnostic and treatment tools, you can generally achieve significant varicose vein relief. While we cannot alter many of the risk factors that predispose you to developing varicose veins, we'll do our best to help you manage your condition. You'll have time to consult with us in greater detail before any procedure we perform. If you have questions or concerns, or if you experience a complication following a procedure, we want to hear from you as soon as possible. Our providers are on call 24 hours a day and can be reached after hours through our office number at 801-379-6700. If you'd like more information about your specific varicose vein treatment process, visit ivein.com or ask one of our providers. We hope this video has helped you better understand varicose veins and the associated risks and benefits of treatment. If you have any questions or concerns at any time, please ask one of our providers or office staff members. Thank you for your attention. We look forward to working with you.